Proximal hamstring ruptures occur during certain forceful movements like sprinting, water skiing, or jumping, and can cause significant pain and weakness. If the tear is complete or pulled away from the bone, a proximal hamstring repair might be indicated. During the surgery, repair the hamstring tendons using suture anchors. After drilling and placing the anchors in the ischial tuberosity or the sit bone, we use needles to pass the sutures through the tendon. The sutures are then tied or placed into a second row of anchors, which pulls the tendon back down to bone and secures it. Early intervention usually improves outcomes, so if dealing with a hamstring rupture, reach out to your local orthopedic surgeon.